who is the Director of Illinois Department of Public Health. Right now we're going to talk a little bit, we're going to give you some more information on becoming in contact with the Cervical Cancer Screening Unit for the Illinois Department of Public Health, and also the HIV Screening Unit of the Illinois Department of Public Health. Dr. Whitaker, can you tell the viewing audience what would be the way to contact those agencies?
Okay. For the HIV/AIDS hotline from the Illinois Department of Public Health, you can call 1-800-243-2437. For the Women's Health Hotline, which includes the breast and cervical cancer screening program as well as other women's health issues, the number is 1-888-522-1282. You can call either of those numbers. They stay open as late as 9 p.m. during the week and as late as 6 p.m. during the weekends.
I see. Now, Dr. Whitaker, do you have any community engagement strategies that you are implementing to help provide better health care to the citizens of Illinois?
Sure. A lot of my thoughts on community engagement has been informed by my experience with Project Brotherhood. Mm-hmm. And instead of us trying to sit some smart people in a room and come up with a program, we actually went out to the community and said, what would it take for you to use a center like this? What do you believe health is? And so, we developed a clinic that responded directly to the needs of African American men in that community. Mm-hmm. At the state level, we believe the same thing can happen. Mm-hmm. That we can go to communities, instead of rolling out programs that we design somewhere in Springfield, mm-hmm. that we can take the data we have at the state level, let people know what kind of health issues are out there for them, and have them help us design programs to meet their needs.
I see. Now, let's talk just a little bit more about Project Brotherhood. They believe in a holistic approach to the African American men's health.
Sure.
Now, can you give us a little background about some of the things that take place in the clinic?
Sure. Project Brotherhood is within the Cook County Bureau of Health Services. Mm-hmm. It's in a clinic where you have the same services as you would in any Cook County health clinic.
I see.
The difference is that all of the physicians are African American males, except for one African American woman we allowed to practice with us.
Okay.
And also at the front of the clinic, in response to the question of what would it take you to come in the clinic, we developed a barbershop setting.
I see.
So we give out free haircuts. We also have different programs that the men suggested we have, namely job services. We help develop resumes, and also we had a rites of passage program that was developed that was Afrocentric in nature and help men come in contact with their roles and responsibilities as black men.
All right. And do you also have parenting classes?
That's right, and that's another of the formal classes that we had to do with parenting class for African American men. Mm-hmm. And I must tell you that the graduations for our parenting class as well mm-hmm. as for our rites of passage program is a phenomenal community experience where we have African drumming. There's a feast essentially, and a lot of men graduate for something for the first time since they were in high school, typically.
I see. Now you mentioned they can come there and get a haircut. They can just come and get a haircut through the clinic, or do they have to do something to earn the haircut?
Well, we certainly, if you come get a haircut, we want you to hang out and talk to some folks.
I see.
But the discussions that the men tend to have in the setting where the barbershop is, mm-hmm.
is
driven by the men themselves. Mm-hmm. So whatever issues the men want to talk about, this is a safe space where they can talk about it.
I see. Now, at Project Brotherhood, they also deal with anger management.
Sure.
What are you finding in regards to that in the African American male?
Well, I think the big lesson for us is that there are typically very few safe places that black men can talk to one another.
I see.
Where they can share their concerns, their fears, their hurts, mm-hmm. and therefore we tend to act inappropriately in certain situations, and instead of talking about things, it escalates to violence and anger being out of control.
I see. So now, do you think that Project Brotherhood would serve a place in a lot of the Illinois Department of Public Health clinics that are stationed throughout Illinois?
Well, we're unique at the state level in that we don't actually have any clinics anywhere, but we work with local health departments throughout the state
to do
clinical work, and we fund them to do that. So, and I can tell you, and I've traveled all over the state in my short 9 months.
Yes.
To the top, to the bottom of the state, and there are men's health programs, both for African American men and otherwise, that are popping up slowly but surely.
Department of Public Health taking in as far as prostate cancer?
Well, we're continuing to support efforts that get men screened. So, in fact, there were some new bills to provide additional funding to have prostate cancer screening supported. And we'll continue to support that even if those new bills are not passed.
I see. And what direction is going to take place in regards for women with breast cancer and cervical cancer?
Well, I mean, that's a priority of the governor. In fact, we have a $5 billion budget deficit, and while a lot of agencies are getting their budget slashed, the governor saw fit to provide $2 million in new money to our agency for breast and cervical cancer screening for African American and Latino women. I
see. And now, in a percentage rate or a ratio, what minority do you find more so in the higher range of prostate cancer, breast cancer, cervical cancer? What minority fits that?
I mean, it tends to be African Americans in both of those categories. The tragic thing about, say, for example, breast and cervical cancer screening is that when African Americans get it, because they delay getting screening, they end up appearing to the doctor much later in the course. So that then you're trying. It's a different sort of situation if you catch a disease very early than if things are way out of control. And we tend to show up, African Americans that is, at a later point in the disease course.
I see. So now, what is going to happen in regards to Illinois Department of Public Health? Are there going to be any changes that you want to bring about here in the near future, year 2004 coming up?
Well, I mean, the number one thing, over the last 9 months of my tenure, we've been looking very hard at how the organization is currently administered. And so we've been doing a lot of inside work and trying to align how the organization structures with the community focus I like to bring about. But we also have been doing a lot of outside work because we need partners everywhere, throughout the state, at community-based organizations and with local health departments. And so we need to share a common vision about where we want to see the state go in terms of health. And a lot of my time has been trying to understand what's on people's minds throughout the state.
I want to ask you this question. What are the initiatives for the Illinois Department of Public Health? What are some of the initiatives that you want to see transpire?
Well, I started April 1st of this year, and we had a new vision of what we want the agency to be.
Yeah.
In fact, we changed the model of the agency from, and I don't even know what it was before, but we changed it to improving public health one community at a time.
Oh, that's nice.
So under that rubric, we picked 7 initiatives that would drive everything we did as an agency. Some of these things we've already touched on. So first of all, we talked about community engagement. It's important that we at the state reach out to communities and allow them to develop solutions to the problems that they see they have, instead of us sitting in Springfield or Chicago and coming up with solutions that may or may not work.
Right.
The second thing has to do with bioterrorism. What I found out, I don't know if you knew we had a bioterrorism drill here maybe 3 or 4 months ago. I found out after I got the job that I was in charge of bioterrorism for the state. And we had this massive drill where us and Seattle, Washington had different diseases that were released here at the state level, and we had to look at how we responded as a state. We did phenomenally well, and it included 6 counties, as well as the FBI, the Department of Homeland Security, and a whole lot of other folks. And so part of what our mission is to continue to make sure that the state stays safe from bioterrorism. The third thing we talked a little bit about was healthcare disparities.
Yes.
And our formulation of healthcare disparities, we include not only racial and ethnic minorities, but also women as well as rural health. Because as I've traveled around the state, I've seen areas in as worse need in some rural places as much as on the south side or west side where I've practiced in the past.
Yes.
The fourth major thing has to do with trying to create a state report card for health. Right now we don't have a single source document that tells us how we're doing as a state in terms of health. And why is that important? As we develop new interventions, we want to know whether or not what we're doing works. So we need to know where we're starting from.
I see.
And so that's going to be a major initiative for us, is gathering data for counties throughout the state and sharing with people what's going on in a formatted way each and every year. The fifth thing has to do with patient safety. You mentioned earlier we have a lot of responsibilities for our department.
Yes.
But we regulate nursing homes and also we regulate hospitals.
I see.
And right now there's not enough information in my view for people who want to know, how good the nursing homes and hospitals are doing out there, so that they can know whether or not they want to check themselves into that nursing home or that hospital. We're now working to get information on the web so that people can make educated choices about what they do. Not to mention that the governor has given me the go-ahead to look at how we might change our regulatory scheme here in the state so that we get better outcomes, better than we currently get right now. And then the sixth thing is improving the public health infrastructure.
Yes.
Over the last decades, public health has not been supported well at all.
I see.
Only recently with bioterrorism threat, with anthrax,
yes.
With 9/11, has the importance of public health been recognized. And we've gotten a lot of funding for bioterrorism, but some of the core functions, like eradicating syphilis or HIV,
yes.
have not been supported in the same way. So we want to continue to get funding, to support our personnel within public health, because right now we're in a situation where a lot of people are retiring, and we need people in the pipeline that come into public health. And the other part of public health infrastructure has to do with data and making sure the communities have data that they need, yes. so they can develop programs and write for grants and also know what's simply going on in their communities. And lastly, another point we touched on, yes. was the whole issue of health care for the working poor. Right now in our agency, we're great at dealing with crisis. If monkeypox happens, we know what to do.
Okay.
What we haven't been great at doing is developing long-term plans for the health, like the health insurance issue, yes. or medical malpractice. And so we're building a capacity within our agency to deal with both of those issues.
Okay.
So that's a mouthful in terms of initiatives, but
yes.
We have our staff excited about tackling a number of these different things.
I see. So it seems like you have really done your homework when it comes to the initiatives for the Illinois Department of Public Health.
Well, preparation meets opportunity.